Hello everybody, thank you for coming back and watching my YouTube videos. In today's video we are going to talk about something totally different apart from UK nursing. Nothing about the nursing in this video, guys. So if you want to avoid this video, go ahead. All right, but it's worth watching. You are a nurse, so I assume you're a nurse, so you would know the situation. So today we are going to talk about obstetric cholestasis. So what is obstetric cholestasis, and when it happens, we're going to talk about this. This video is especially for one of my friend, a close friend, and then this is just for a reassurance for her. I'm making this video. All right guys, please, if you don't want to watch the video, you can skip it, or you can just go back to your YouTube. Okay, so this obstetric cholestasis, what happens? It's a fancy name, isn't it? Obstetric cholestasis, it happens in the pregnancy. If you're pregnant, it usually happens after 28 weeks of pregnancy, and then it runs in the family, but sometimes you can get it even when you don't have any family history. Okay, so what happens in this situation? I'm so sorry that you have to struggle with this one, but I hope everything goes well and you're gonna get a healthy live baby. All right guys, all right lady, my lovely lady. All right, so what happens in this situation if someone is diagnosed with obstetric cholestasis? So the symptoms only the patient gonna get is like severe itching all over the body, but basically mainly on hands and feet, and then it get worse at night. So the pregnant woman after 28 weeks of pregnancy, sometimes it can come before 28 weeks also. So if you're feeling like, if you're pregnant and you feel like you're having itchiness all over your body or on your hands or feet, talk to your midwife or talk to your maternity triage. Okay, so they can give you a treatment. There are medications for it, and then they're gonna monitor your blood test also on weekly basis. So what happens in obstetric cholestasis? I'm sorry. So what happens in obstetric cholestasis? I can never pronounce this name. Intrahepatic obstetric cholestasis. So chole means bile, stasis means still there. Okay, so what happens normally in our body, our liver produces bile goes to the gut and help in digestion of the food, isn't it? So if in pregnancy, if someone is having this condition, bile doesn't go to the gut, and then the function of the bile is not proper. It's disturbed due to certain hormones in the pregnancy. Okay, so bile doesn't work properly, liver doesn't work properly. So when you tell to your midwife or to your doctor, first thing they're gonna do is your liver function test, your renal function test, or your bile acid test as well. Okay, these are the three tests. And also on the other hand, they're gonna rule out if there is any other condition. They're gonna maybe they can rescreen you for hepatitis B, C, or CMV, or you're gonna have your liver function test after 1 week. Every week again, like every week they do the liver function test also. Okay, so they're gonna keep a close eye on your liver function test. So nothing to worry about the test, because what happens is with this cholestasis, sometimes there are chances you can get premature births and stillborn, and also IUD, intrauterine death as well. Okay guys, so yeah, I think the better you inform your doctor or your midwife, the better they're gonna handle the situation. And after you be not diagnosed with I don't know what to say, to be honest. So after you've been diagnosed with this condition, they're gonna do your weekly test. They're gonna prescribe you some menthol cream. It's a 1% menthol cream they usually prescribe. You can put it on the affected area where you get the symptoms of itchiness. Usually it's all over, so you're gonna put it all over. It's a cooling agent and emollient also. And then also they're gonna give you some antihistamines, so chlorpheniramine, sometimes and also there is a particular tablet, it's very difficult name, ursodeoxycholic. That's the name, ursodeoxycholic, that's the name. That's the tablet they're going to give you, and it's usually like you're gonna take these tablets 3 times a day. And keep in mind that antihistamine can make you feel sleepy and drowsy, so if you work, you need to take some time off to adjust to the environment, to adjust to the medications you're taking, and then to adjust to your situation. Because if you're gonna so my friend, she was complaining that she cannot sleep at night. It's all over the body, itching and itching and itching and itching. It's quite uncomfortable condition, isn't it? So keep in mind that you need time to rest. If possible, take some time off, rest as much as you can during the day. And if you're feeling dizzy with the antihistamine, try not to drive or use a machinery or any kind of like if you're cooking, keep an eye. Tell your husband or your colleague or whoever is with you, tell them to keep an eye on you, because you may fall with this dizziness, isn't it? It can cause a drowsiness, the antihistamine, the anti-allergic tablet. All right guys, so if someone is pregnant, suffering with the situation of itchiness, don't take it light. Go to the doctor as soon as you find out that someone is having this problem, someone is having itchiness. Report it to the midwife or to the doctor, and then they can start the treatment. Also, they're gonna do some scans on your liver and ultrasound, or they're gonna do some scan on your liver, and then to see if you're not having a fatty liver, or if the size of the liver is enlarged or anything like that. Okay, but there's nothing to worry. Keep praying. Hope everything goes well, and then I'll also remember you in my prayers. And take your medications on time. The mental health is more important. It doesn't have any adverse consequences on the baby, but a very uncomfortable situation for the mother who's suffering with the itchiness, because she would be afraid of going out or going anywhere, to be honest. Because if you're having itching all over, it's very like, if you itch in front of somebody, maybe they think that this lady doesn't have manners, she's itching everywhere, but they don't know your situation. So just go with the flow. Don't think too much. Keep remember to pray every day for this situation. Everything goes well. Everything will go well. Don't worry too much. Take your medications on time, and then if you have regular blood tests or scans, go for them. Don't skip any of those. And then keep an eye on the fetal movement also. There are chances of stillbirths, there are chances of fetal distress or meconium aspiration. So there is nothing you can do at this time. Only God can help you with the situation. And then keep praying. Hopefully you will get a healthy life and then handsome baby. All right guys, thank you so much for watching. Please, if someone is suffering with this situation, share this video with them. And then the most important thing they need is your emotional support, your help. If you can reassure them, if you can give them some time to sleep. Honestly, it is difficult for the mother and the baby thinking about it. And then the mother needs to be, mother sometimes get very worried about the baby and the baby movement, because every time you're gonna call the midwife, the only questions they're gonna ask is like, is the baby okay? So as a mother, how would you know? I mean, you can feel the baby movement, of course, but sometimes babies, they don't move for 4 hours or 3 hours. So what you gonna do then? I think it can be difficult, right, to answer this question. So keep an eye. If someone is suffering with this situation, keep an eye on the baby movement, and if you're taking the medication and still you're having itching, talk to your doctor that I'm taking the medications on time but still I'm having itchiness. Maybe they will and they will do induced labor early on after 30 weeks of pregnancy, because they don't want to take risk. So keep an eye on everything, and then I hope everything goes well, and then we'll see the baby soon. All right, thank you so much. God bless you. Take care. Remember to pray every day. Remember to pray for this particular condition. Okay, thank you so much. Bye bye. Take care.